talking about the pharmacy funding and contract, I think we all accept that our pharmacy funding and contract are unacceptable at the moment and that our contract needs reviewing and changing. We discussed in terms of the current funding model, how pharmacies are doing more for less because they're doing more items for less margin. We talked about the fact that there are so many other professions like doctors and dentists who are competing for the same pot of money, and what we should be doing to stand out in terms of what community pharmacy can bring for value to the NHS. We talked about hub and spoke and what are the realities around hub and spoke, and some of the numbers in terms of that are optimistic, more optimistic than they should be. So therefore it's important for people to dive into and look at those numbers. And we talked about the next year in terms of what people felt, how they were progressing, and some private services that are coming, for example weight loss jabs and so on, and what the future of pharmacy would be in the next coming months. Well, obviously the government wants us to be more service orientated, and we've seen, for example, with the weight loss jabs that the market is there in terms of people wanting to pay to go private. But what we need to do is to make sure that the government actually sees the value of community pharmacy, ensuring that if they want us to provide services, then it needs to be compensated properly. It should be like a pull service rather than a push service, so not dependent on GP referrals. We've always said we're happy to do that, but we are not really going to accept doing more for less.